So the question is, how involved is eyelid surgery and will insurance cover it ever? Eyelid surgery sometimes requires you actually lifting your eyebrow up. A lot of people feel like they come in with heavy eyelids, but the problem is that their eyebrow is low. So we like to be able to raise your eyebrow as needed, and we also like to be able to take out upper eyelid skin if we need to as well. As far as the eyebrow, there are 4 general ways that we do that. Sometimes we make an incision all the way across the top of your scalp. It's called a coronal incision. We take out some skin and fat and we pull the forehead up. Other times you use an endoscopic technique where we put a camera underneath the skin and an instrument underneath the skin and lift the forehead up that way. You can also make an incision right at the hairline. It's good if people wear bangs and their hairline is a little bit low. You can make an incision right across that area and lift the forehead up. Lastly, if somebody is older, particularly a gentleman, and they have very deep forehead creases, we can put the incision into those forehead creases and raise the brow that way. What insurance usually looks for is that a patient has enough skin that it's pushing down on their eyelashes, or that they have enough skin that it's causing a visual field obstruction. We'll send our patients to the ophthalmologist or optometrist to get a visual field test, and in the visual field test, that will document a certain degree of visual field obstruction. If they have a 30% obstruction or greater, then the insurance will likely cover that. If it's less than that, most of the time insurance will not cover that. Certainly at the end of the day, the insurance company has the final say on that, and they will determine, sometimes just based on photographs, whether a patient looks like they need the surgery or not. I've never had a lower lid blepharoplasty or eyelid surgery be covered through insurance. Lower eyelids is really considered in the cosmetic realm, and patients can have that done as well, but usually that's outside of insurance. The first day or two are most of the time spent at home. After that, patients will sometimes put on sunglasses and venture out, maybe even going to the grocery store. After the 5 or 6 days are up, the sutures are out, patients are most of the time comfortable being out in public. Say it's about 3 weeks until a patient is comfortable being at a wedding or a party or a big event where they wanted to look their best. There are little subtle changes that continue to take place for about 3 months after blepharoplasty. After that 3-month time period, most patients have a hard time seeing the scar line. The bumps and lumps that are under the skin seem to be resolved and much softer, easier for patients to manage. You know, I've heard some plastic surgeons comment at meetings that eyelid surgery is the most refined, technically precise surgery that we do, because if you take a millimeter or 2 of too much skin, you've got a real problem. You can't close your eyes. You've got a chronic issue on your hands. If you leave too much surgery on a regular basis, all of your patients are coming back in and they're needing to have more skin, more fat taken out, and having more surgery. All of those things are important aspects to blepharoplasty that are best managed by somebody that has extensive experience in blepharoplasty and preferably as a board-certified plastic surgeon. So hopefully that answers the question of is upper eyelid surgery easy? It's really not that bad of a recovery. I even tell my patients it's the only surgery that I do that I'm probably going to have myself someday because I've got upper eyelid skin myself.